I've been asked to present some of the latest data and the updates on the COVID-19 and the Delta variant in the light of the recent surge in Delta variant cases and the vaccine mandates. My name is Mary Ann Williams, and I'm a nurse practitioner in Okanogan County. I've lived here and worked here most all of my professional life as an RN and a nurse practitioner and a nursing instructor. I have served on the Washington State Nursing Commission, on the North Valley Hospital Board of Commissioners, and I am currently on the Okanogan County Board of Health. This is a two-part series. So the first part is the latest updates on COVID-19 and the Delta variant. There'll be a second, or a part two, that's answering common questions about COVID-19 and about the vaccine. So stay tuned for other things to come. The goals for this session are to get the latest information on the COVID-19 in Okanogan County and to understand the Delta variant. There have been a lot of questions going around and people are having a lot of information floating around. So this is to try and clear up some of that and to present that. So you can see from this graph that the COVID-19 cases are increasing rapidly over this last month, and you can look at the steep increase here and compare it to that in November of 2020, and it's as steep now as it was then. So you can see that there is a rapid increase now like there was then, and this is all from the Delta variant. This slide shows that in August of last year in August of this year to the end of August of this year, how much that the cases have increased here in Okanogan County. So there's quite a steep increase here. You can see that the latest number was 334 as of the 28th of August. When this first started, we were seeing small numbers, but this has just been a huge increase here. So the Delta variant itself is now estimated to represent over 99% of the cases in all of the United States. So what is a variant? You probably remember from anatomy classes that viruses and bacteria are different. Viruses are free to mutate and do that. So that's totally expected. And so they have mutated. We don't even really know there's a debate whether they're really not an organism really, but characteristic is that they change over time and mutate. So the Delta variant is a mutation, and so there are several mutations. This is one of them. So what are the concerns with the Delta variant? From this slide, you can see that the Delta variant is way more contagious than the original COVID-19 strain, more than twice as contagious actually. There is a concept called R0, which says any person who's infected could infect so many more people. The original one, a person infected would infect up to 2 other people. The Delta variant can infect 5 to 7 more people. So it's way more contagious than the original COVID-19 virus was. The other thing about the Delta variant is that it seems to cause more severe illness in unvaccinated people compared to the previous strains. So the takeaway about the Delta variant is that it's more than twice as contagious, and it can cause more severe illness than the strains that are circulating when the first vaccine became available. So that makes the Delta variant much more risky. So then what about the vaccines? Fully vaccinated people with breakthrough Delta infections who are symptomatic can spread the virus to other people. However, vaccinated people are much less likely to contract the virus than unvaccinated people. and vaccinated people with the Delta virus appear to be infectious for shorter periods of time. So breakthrough, the definition of breakthrough infection is, according to the CDC, somebody who has been fully vaccinated. That means that their vaccinations have occurred 2 weeks or more ago, both doses, if it's the mRNA or the one dose of Johnson & Johnson. So it's at least 2 weeks since their last dose. They're considered fully vaccinated. And then they get a dose, then they get the virus. So that would be considered a breakthrough infection. So what about Okanogan County? We know that vaccines are working in Okanogan County. And how do we know that? Well, in the last 7 months, 95.5% of the COVID-19 cases in Okanogan County have been in unvaccinated people. To date, less than 5% of the COVID-19 cases are people that have been vaccinated. So you can see here that vaccination is important to keeping people from getting the COVID vaccine, especially to getting the COVID disease, especially this new Delta variant. So it is working. And so it has really helped people from getting the Delta variant. In the last 7 months, from the data that we have, 100% of the deaths and 98% of the hospitalizations from COVID-19 were in unvaccinated people. So the 7 months figure comes from when we started vaccinating people. So since the vaccine's been available, people who have had the vaccine have not died from COVID-19. And if you have been vaccinated, you're way less likely to be hospitalized. 98% of the people are less likely to be in the hospital if they have been vaccinated. So the takeaway from that is about vaccines and the Delta variant. Vaccines provide a strong protection against contracting COVID-19, including the Delta variant. So if you're fully vaccinated and you get a breakthrough case of COVID-19, which isn't likely, but is possible, vaccines provide a strong protection against hospitalization and death from COVID-19. So we do know that the vaccines work and help prevent those comorbidities. So stay tuned for part 2, the latest updates and answers to common COVID-19 vaccine questions. So if you do have some other questions, where can you get information and answers to those? So the Okanogan County Public Health would love to hear your questions, and they have some answers and some information available, which they update, by the way, on a daily basis on their website. So here are some websites for you that you could go to get information if you don't already know about these. The Okanogan County Public Health COVID website. And then they have a Facebook page as well. So they post those and update those daily. So those are good places for current information about what's going on in the county and how many people have been vaccinated. There's also how many cases that are out there. And you can even find out what the vaccination rate is in your area of the county if you want to know that information. So those are good sources of information if you have interest in finding out those on a daily basis. Thank you for listening and stay tuned for part 2.